put crowns on the teeth, they want veneers on the teeth. Sometimes it's just to put a crown on it because the tooth is broken down. We also do a lot of anterior crowning thing for post-orthodontic or overcrowning. Okay? So a lot of the above. So now understand there's two types of tissue. Type 1 tissue is really thin. Okay? Type 2 tissue is thicker. And the difference is that if you haven't done these, work on type 2 tissue first. It's a lot more forgiving. You can cut on it and it's not going to recede. Type 1 tissue, once you put a little indentation in it, it's going to go. Okay? So if you've never done these, then go start with type 2 first. So this guy came in. He's got braces, and they wanted to restore the teeth and see all the wear they have. So, what type of tissue first? Type 1 or type 2? Type 2, it's thick. Okay. Well, one other thing you have to understand. So I did some of the beginning crown lengthening. And I did this on purpose. But right underneath here, something's going on, and it's bone. So if we do this closed, which I did on purpose to show you what would happen, when we flap it back, I create infrabony defects. See all the defects in there? Now I created a perio problem. So when it's thick bone like that, you can't do it without laying a flap. You gotta lay a flap to do this. And then you gotta grind all this bone down, whether you use a laser or a handpiece, so it's parabolic, and then you do your crown lengthening that way. Okay. So let's talk about soft tissue first. Okay. Now in this case, I've done half of the mouth, and I decided this would be a good case to teach. So one side's done. And we're gonna do this side. So this is a variant tip, and we're using probably 30 Hertz, SSP mode, and anywhere from 50 to 80 millijoules, depending on the tissue. This is a thin biotype. See how thin the tissue is? It's very thin. And what you're doing is we're using water because it slows your cut down, and we're reshaping the tissue. Okay. Now you get a little bleeding here, and if that becomes a problem, we'll just increase our pulse duration, more heat, but it doesn't become a problem. So basically, I love these cases, especially after lunch. They're no-brainers. They're kind of artistic, they're no-brainers. And what you're doing is leveling out the margins. And you can see the water particles just cutting the tissue. And then we did a little bit of this yesterday, we may have done some today. Basically just reshaping the tissue. And just take your time. Now this is the tipless handpiece. And in a couple of these videos you're going to see the straight handpiece. It just makes it easier, just ergonomically easier. This is, and you can do it, but it just makes it. So wait, see how I'm forming the margins of that? Okay. Now if I did this without water, it'd be much more aggressive cut. And you always finish, even if you took out a lot of bulk without water, you always finish with water. Always finish with water. Okay? Okay, so this is what it started with. That's how the patient came in. That's what it was the same day. We did a frenectomy, reshaped the tissue. So in other words, start, finish. 3 weeks later, it looked like that. That's how fast these heal. We use erbium. Erbium only cuts 2 to 5 cell layers. We don't use Nd:YAG. Okay. But this is something, it's really easy to do, and you should be doing this in your office. A lot of times the dentist will come in and watch me do it and kind of point what's going on. And you'll see that in one of the videos, the patient actually pointed what was going on, because he's such a control freak, you see your finger come up and point. Okay. So here's the crown lengthening with this straight handpiece, and you're going to see the difference ergonomically. The result's the same. Okay. So here's my tip carousel. Picking the tip I want, it's like I'm shopping. Except it's cheap because I already bought it. So there's the patient. And we're going to crown lengthen this. The tooth cracked. And they want to take the tooth out, but it's just a fracture that can be fixed. So this is the chisel tip. Okay. Notice how it's flat on the tooth surface. See how it's flat on the tooth surface? So I'm gonna turn the chisel tip on. This is the straight handpiece now. See how I'm holding that a little bit differently? I'm just gonna reshape that. I'm gonna reshape it to what I think is gonna match the other side and give me enough crown. So you see how slow I'm doing that, okay? And I'm slowly reshaping. Could you use a variant tip? Yes, you can. This is the chisel tip works really nice. On this case, every case is different. You can use any tip you want, any cutting tip. Okay. So I'm kind of evening the margins between the centrals. These lines are actually my xenon light, overhead light. So the lines are. I learned you can't put that on. So now it's dark except my head. So after I do that, now I'm going to do I've reshaped the other two. I'm going to go and crown lengthen this. And as I crown lengthen it, then I'm going to lay in mini flaps so I can get to the bone and reshape the bone. Okay. But I'm not going to go past the mucogingival junction. So I'm reshaping that. Okay, so now you see it looks better. And just take your time. It's no rush. Okay, now I'm measuring the two so they're even. Then what I'm going to do is a little mini flap. This is a microsurgical blade. I'm going to bevel the incision so the pieces overlap when we're done. So now I'm just doing a mini flap. Again, I'm trying not to go past the mucogingival junction. So there you can see where the tooth is broken down. So now I can release bone. I can go right in the bone and reshape the bone with the chisel tip. Okay? So we could use 20 hertz SSP, 50 to 100 millijoules, depending on what you want to do. But you can see how easy the bone just disappears. The nice thing about using a chisel tip or any tip, laser tip, is you're not going to etch or grind against the tooth. So sometimes when you use a burr in there, you can notch the tooth real easily as you go towards the tooth. This is end cutting. Okay, see how easy I crown lengthen that? It's simple. The bone just dissolves underneath there. And some of you did that yesterday with the laser, and you saw how fast the bone went away, the chisel tip. You can go right into proximal with that.
This will not cause a recession, right?
Pardon me?
This won't cause a recession?
No, because I haven't moved this past the mucogingival junction. Okay. So you can see how conservative my flap is and how cautious I am.
So how many millimeter from the CJ to the bone?
Well, it's not the millimeters from the CEJ from the bone, it's where your restoration is going to be. So from the end of your restoration to the bone has to be minimum 3 millimeters.
Yeah.
That's your biological weight.
Yeah.
So it's not the CEJ.
Okay, yeah, that's a full restoration.
Yeah. So now I can reshape the papilla and then I can put everything back. So the thing you did know is they wanted to take this tooth out. And I said, why are you going to take it? And the guy didn't want it out. And he went to 3 different dentists and he said, could you save it? I said, yes, I can save this tooth. Some of them I can't, but this one I can. So you can see me using the chisel now just to reshape the tissue. So I start with reshaping the tissue. I then reshape the bone, and then I'm going to go back. And now see I'm measuring the biological width.
Mm-hmm.
I want to make sure I have enough space.
Mm-hmm.
And if I don't, I'll bring it down a little bit, bring it more. And then when we're done, we'll put a couple sutures in there. Here's our Nd:YAG to create a clot. We always use to create a clot when we're done. Okay, see how the blood turns magenta? Real quickly. And then I did a little bit of reshaping on the lingual, and you can see where I just reshaped that just a little bit. And that was just soft tissue. And then I'll put a couple sutures in there. So now look how nice that looks. Yes, it was. Okay. Again, minimally invasive. So that's how it looks when you're done. There's the lingual. There's the buccal, checking a biological width one more time. Oops, that's not what I want to do. You take your finger and move it just a fraction, and it totally skips. And that's what I use. And that's what it looked like afterwards. So I evened out 8 and 9 and got a nice result. So you asked how much it will shrink? Very little. Very little. Okay, so this is another case. This is where somebody sent the guide for me, and I marked it with a plastic surgery skin scribe. Recently, we've been taking an Nd:YAG instead, and we just make little punch holes with the Nd:YAG about that. It's even easier than a skin scribe. And then we just kind of go around right to the Nd:YAG lines. But this is the same thing. I'm measuring the biological width. I have plenty of attached gingiva, so even if I trim it there, we still have enough attached gingiva, so you don't have to worry about that. If you had no attached gingiva, you'd have to raise the whole flap and apical reposition it because you cut it all off. So the first thing, do I have enough attached tissue? Yes. Is it thin tissue? Yeah, it's relatively thin. It's not thick. And the bone is thin. So if I have to remove bone, I can do it by just putting a chisel tip underneath and taking the bone off without laying a flap. So what I did is reshape the tissue per the guide, okay, because I have the guide. So I followed the purple lines. And then when I'm done, I'm checking the biological width again. Then I'll take the Nd:YAG, but now when I take the Nd:YAG, I'm going to pass it on the outside. We don't put it in a pocket because we're not doing pocket surgery. We just go around the margins and we seal it. And the patient, that's what it looks like afterwards. Now I always warn, is that you got to tell the patient that you're going to seal the ground margins. Because if she has a big event the next day and you made her look like that, she'd kill me. I always say it's going to look ugly for a couple of weeks. So when could they prep this? Well, they could prep it in 6 weeks if they want. So, okay, here's another crown lengthening. This is on the lower. And again, this is where we mark with a magic marker. Now we would use the Nd:YAG. We would mark all around the Nd:YAG. So we're measuring the tissue. We got plenty of attached tissue. But this is all bone. This is all bone. So we're probably going to have to flap this, and we did have to flap it. Okay. So it's important to see where the bone is and what you're doing. So we reshape it all. And you can use, I'm using a variant tip because they're small teeth. The chisel tip would be too big. Okay. And we're just reshaping the soft tissue. So once I get all the soft tissue reshaped, then I can go in and flap it back. Okay. So here I have it all reshaped, and I'm going to flap it back. Again, real gently with the surgical blade, just popping the papilla. And try not to apically position it or go past the mucogingival junction if I can avoid it. Reason is once I take past the mucogingival junction, the tissue is going to move this way. So there we are there, checking our biological width. And then we're going to take our laser and reshape the bone. And we go around each tooth like that. So a procedure like this will probably take close to an hour and a half. But it's kind of a fun procedure. It's not really you don't have to overthink it or anything like that. And then for the thickness of the bone, we actually we then reshaped that also, so that's what it looked like. And when we were done, we went in and reshaped a little bit of the bone right there, the thickness, because he had a big bony exostosis. And then after that, we put it all back in place, put the guide in place, suit, periacral there, and that's what it looked like. Okay. And that's our settings. So this is a closed crown. Now this guy was weird. Okay. He was bulimic and he wanted triangular shaped teeth. It was from a prosthodontist and I got the guide and I go, is this right? He goes, yeah. I go, are you serious? He goes, yeah. I go, okay. So there's your triangular shaped teeth. I mean, so the tissue was way down here. It was way down here. So I brought you can see where that line is. So I brought the tissue up already, but now I have a bone problem. So now I'm going to do a closed crown lengthening by taking my chisel tip, and you're going to walk it around. So you're going to make an incision here, you're going to make an incision here, you're going to make an incision here. And as you do that, again, the chisel is just, flat instrument. It's the laser energy that's going to move the bone. So as I do this, you're very careful and you walk it around just like that. Okay? And as you do that, you feel the bone just kind of release. Don't, you see where my chisel tip is hit, it's on the tooth? Don't angle it like this. You go into the tooth. Okay, just hold it there. The bone is thin, it'll just disappear, and then after you get a couple, then you can go in there and smooth it out. If you want, you can put a magic marker mark on the chisel tip. So it's like 3 millimeters or 4 millimeters, so you know where that margin is. To me, I don't have that problem. I just go in and do it and measure it. It's that easy. I don't like my tips marked up. But see how I'm doing that closed crown leg thing? It's pretty simple. Okay. But the bone's got to be thin. If you had big exostosis up there, you got to flap it. And then we measure again. See how it just falls in now? And those are our settings. And the reason they're different is because we're on bone. So the 20 hertz is because we're on bone. Okay. So this one here was a dentist's mother. And he came in and he said, I want you to crown lengthen number 6. And his wife, who's also a dentist, came in. So one was on one side of me, one was on the other watching. Okay. So this is where we started. You can see us measuring everything out. Okay, the lingual's not that bad, and it's going to trim the tissue. So we're taking the blade first, because I know I'm going to have to relieve some bone in it. And it's a little thick. So I'm going to real gently pop the papilla. Okay, and then I'm going to take my laser and start doing my crown thing. And again, the nice thing about a laser is it will never hurt the tooth unless you put it into the tooth. Again, this is a straight hand. See how I put my hand on this? It's so much different than the contrary. So I'm just painting around there. And then I'm checking and I'm painting around. And I'm getting the height correction. I'm asking him what he wants. Now you can see I have my biological weight there. Okay. Then once I have that, I'm going to reshape my tissue. So now this is the tapered sapphire tip, and I'm going to paint my margins. So I get exactly what he wants. And he's standing there and telling me what he wants. Okay. that's the lingual. All I had to do is take soft tissue away in the lingual. There's the buccal. And then I'll put a suture in each patella. And that's it. Simple thing you can do in your office. Very minimally invasive, minimally painful, no swelling afterwards. And about 8 weeks later, you can do your crown. You can put a new temporary on if you want it that day. Okay. So this one here, if I remember this correctly. Okay, so this is the lady that was, the referring dentist warned me. He said, this lady is whacked. She's gonna take up all your time and she's gonna make you do procedure 3 and 4 different times. Okay, so she came in like this. She's gonna have veneers on the 9. Okay, they want the teeth longer and she wants the teeth even. I said, okay. And I said, well, let's take the frenum off also because you have that big bulb of this frenum. So you're going to see both here. You're going to see how to take the frenum off and you're also going to even out the tissue. But this is a lady you're going to see halfway through, puts her finger up because she goes, I have a mirror, she's pointing to what I'm telling you. She's pointing to what she wants. Okay, so I'm measuring my biological width. Then I'm taking, again, any end cutting tip. You don't want a radial tip here. You don't want to touch the tooth. Can you use tipless? Now, we talked about this yesterday. Remember, I said don't, and this is why. I mean, I can't get a tipless handpiece that accurate. But I can use a tipped handpiece really nicely, and I can put the handpiece against the tooth, and it will never bother the tooth. So you can see me forming the margins. I'm really careful because this lady is so crazy. And if I didn't treat her father, I'd say, no way. But her father's a real sweetheart. Okay, so you can see the difference now between 8 and 9. You can see a huge difference. Okay? So now I'm measuring the adjacent teeth and I want to blend everything. Now, see how little it takes off at each time? That's because you're using water. If you took the water off, that tissue would disappear that quickly. And you would have a nightmare. Look, see your finger? I told you, her finger goes up and tells me, right there, she tells me what she wants. I didn't even ask for her input, by the way. Give me a mirror, I want to see that.
You switch the tip to a smaller tip.
Yeah, it's a smaller tip, and it's easier. So you can go back and forth with tips. That's the beauty. I only have, and I switched it again. See, because now I'm going to take the freedom off. Okay, let me hold right there for 1 second. Okay, so when you take freedoms off, what you want to do is be able to grab the freedom, just like that. Okay. Now you can use any tip you want. The best tip for freedom removal is the chisel tip. Because you're going to see how quick I'm going to do this. If you use a variant tip, if you use a tapered sapphire tip, I wouldn't use a chisel. I mean, I wouldn't use the cylinder, it's way too big. But you can use a 600 micron tip, but you can use a chisel. The chisel is nice because it's flat, you go right in there, and you're going to go from side to side, and you're going to pull. And as you pull, you're going to release all the fibers. And then when you get up here, you're going to scar it with this come back down. And then you can use the chisel just to make all the sides even. Now, a lot of times when they come in for just frenectomies, I end up reshaping the maxillary anterior. Now look how nice these teeth look. So you see a lot of bleeding, you see a lot of trauma. That's minimal, something you can do in your office. If you wanted to put temps on, you could do that at that time. I mean, I wouldn't do final crowns. Let the tissue heal a little. Okay, so now let's do the freedom. Okay, so here I'm pulling on it. And again, it's the chisel tip. I'm gonna go in. And as I'm pulling, the fiber is gonna release. And you're gonna see how quick this actually is. You see how I'm going on either side. Now you have some bleeding. If you want to cut the bleeding down, you're going to increase the pulse duration, but it's not going to cut as fast. I'm fine with the bleeding. It's not in my way. So when I do this, watch the freedom just kind of release totally. So now I'll take off the excess tissue. The chisel tip is great at that. And now I'm going to reshape all that tissue. See how I turn my hand with the chisel tip? That's the nice thing about the straight hand piece. Okay, going right down the bone now. See, I'm going down the bone. That's your scar. And then I'm going to reshape the tissue.
So go ahead. Bone, are you touching it? Or
Yeah, I'm going right to bone. I go right into bone.
Okay.
I'm on bone.
Mhm.
I'm creating, my clot, the NDI. And that's where we started. And that's where we ended up that day. Okay. Now, what to expect? I mean, we just sealed the periaquial. Should probably have very little of any pain. Okay. Well, not on the street anymore. Very little of any pain. The tissue, I end up going back in one more time and just bringing this up a fraction as a heal. And that was really easy. So when they come in, I don't charge them again. But this is actually less than a 10-second procedure. I put a little topical on it, I get the laser, and it's done. Okay, it's not a big deal. And I always tell people, I said, when I go in there, we're going to do the majority of the work. I said, but we may have to tweak it a little bit. And it's usually not an issue at all.
So when you do this, you're numbing the patient or just with?
No, I numb the patient. But if I went to go tweak it,
Yeah, then.
they stop. Because it's just, it's literally 10, 15 seconds of work. But I want to make sure that, the patient's happy and the dentist is happy. Okay, here's another crown lengthening in the posterior area. A little bit different, okay, because we are going to lay a flap. We're going to use the laser to reshape the bone, and then we'll use the laser to reshape the tissue. And this lady stopped brushing, so the tissue looked like hamburger meat. So you see me going in there with the laser now. We take out all that excess tissue. The neat thing about the laser is these spaces are so tight you couldn't get a burr in there anyway if you tried, unless you destroyed the tooth. Now I don't like to modify tooth structure because that's not what the patient was sent here for. So I'm just trying to get into the bone area to crown lengthen the bone. Okay. So I'll take the laser and reshape some of the tissue. I have plenty of attached tissue. So we'll reshape the tissue. So you see how I'm doing that? Now I get an idea how much crown length I need. And remember, you need minimum 3 millimeters of biological width. Sometimes you need 4. So in the molar areas, I like to give almost 4. Okay, after I reshape the tissue, then I'll go in there. the tissue all reshaped now. Now I flap it back to the pillow, and I can reshape the bone. And see how tight that is in there? So I don't have to use a rotary instrument in there at all. And that's the nice part. So if I'm using this cylinder, and I can go in there and put a lot of energy into that cylinder, and the bone will just melt away. And we just blend it out. Now this is something you don't want to cut down the water on, and you don't want to increase your pulse duration. This is bone. So you're not going to move your pulse duration. So you just go in there and reshape it real nicely.
SSP.
That's SSP, yes.
And do you want to, afterward, do you want to go back to QSP?
No, you
smooth
don't.
out? No?
No, just SSP.
Finish it off? No.
No. So what you're going to do is finish the bone's done. You put the tissue back, and then you just reshape the tissue so it falls real nicely in that spot. A lot of times it's doing the corners, and so the papilla just lays flat, and then you put a suture in there. Before you do that, you'll use an ND activated clot. So a couple more cases. So this lady came in and said to me, she goes, "I've been saving my money to fix my smile." And so I called the orthodontist. I said, "Can we take the braces off now until you reshape the tissue?" I go, "Are you serious? I got to work around all these things." So we did. So she has a lot of thickness of tissue, as well as a lot of tissue, period. So it gets to be a little bloody in there, okay? Now the thickness of the tissue, you can do some of it without water. And then when you finish it, you're gonna finish it with water, okay? So you go back and forth. And see what I'm doing there? I tried it on my hand first. Always start the laser outside the mouth, because it takes time for the water to get in there sometimes. And if you start it in the mouth and it's delicate, you just put a big hole in the tissue. Always start the laser outside the mouth. So we go in and start reshaping all this. And it's a lot of work. This takes 2 hours to do. We got a lot of tissue. So we start reshaping. And I'll usually do 1 tooth at a time. You can start seeing we get some form in here. Then after I get the first tooth, I'll go on the second tooth. And these are fun to do. You gotta create a smile out of nothing. But you're gonna see that what's here is the tissue really thick in here. This is all gonna come down in here. So what I do is my gross reduction. You could do it with water, without water, it doesn't make a difference. If you do it without water, it'll be a little less bloody, but it cuts a lot faster. So whatever you want to do. The thing you don't want to do is touch the tooth. But now you can see these teeth are starting to pop out from under the gums. We got a lot of reshaping to do too. So we're gonna get the majority of the thickness done, then we take a small fiber and go in the process. So we keep on going. Start to look like real teeth. I keep on going back and tweaking it. And again, going around the power chain was a real delight. Okay, so that looks awful. So now we're going to use the Nd:YAG to create a clot. But it's not that awful, I'm going to say. Just a lot of bleeding. That's all it is. Okay, but you can see that we took a lot of thickness down, as well as reshaped the teeth. Okay. So what is she going to feel? She felt hardly anything. Wasn't something. So we do photobiomodulation after each of these.
Do you have to remove any bone on this case?
No, it was all soft. So now you can see it, you know. that's the power of creating a plot. You know, stop bleeding. And you're gonna have spots that keep on bleeding and just go over them and take your time. And then I'll just seal it very out. And in these cases, I usually don't pack them. I never pack these cases. So there's our periacral. Again, make sure it's dry. Let me put this on. So you can see we took a lot of bulk out. We reshaped the edges here. Okay, so it looks nice. And then I'll get her to come back in a couple of weeks and take a look at it. And my instructions are don't chew in the front, basically. Okay. And it went from that to that in 8 weeks. You think she was happy? Oh, she was smiling whiter than you think. And she goes, this is exactly what I was hoping for. By this time, all the braces came off, and she has a beautiful smile. So, but it was a lot of work. A lot of work. Okay. But that's what makes it all worthwhile. Fun cases to do. Okay, 1 or 2 more, and then we're done. We'll take it. Here's another case. This is a patient from a referring dentist. The receptionist came in and said, my daughter has recession. I said, well, it's not recession. She says too much tissue. No, it's receded. I go, no. I said, trust me, let me reshape the tissue. So we reshaped the tissue, and she went out like that, and mother started to cry. Because, I mean, these are the biggest thing you can do for people, give them a smile. I mean, you know, and you do it because you restore. I don't restore these, so I give them back in soft tissue, you know, stuff like that. I've had so many hugs and smiles and cries, and, you know, it's just very emotional at times. People say, this is a smile I always wanted. So she left like that immediately afterwards. And she didn't brush, but that's what she was like 2 weeks later. Okay. So, easy case, fun to do. Okay. But again, don't use tippets. Use a tip. Use a tip. Okay. Here's the last one. This is a friend of mine's daughter. And we went from here to here. And that was done. And he never said anything. And I said to him one day, I said, Matt, you ever look at your daughter? He said, well, why? I said, well, I picked your gums, I said. And I said, you paid for it. And then he came up to me and goes, yeah, he's texting me a text with that, well, everything looks good. So anyway, so that's the power of what we do. Okay.
Did you flap her?
Pardon me?
You know flap, right?
No flap. Okay, so this case is, I don't know if you've ever seen Crohn's disease in the mouth. So this lady has it's like hamburger meat. So we just took it, it was a bloodbath. It was so bloody. It was water on, water off, it didn't make a difference. Okay, so we just went in there. Like, I'm just holding the big chunks of tissue, look at that. So this is a chisel tip. I'm just taking them all off, okay? So I'm just trying to make sense of it all. We went in here and just, you know, started taking everything apart, just thinning it all out. Look how thick that tissue is, big chunks of tissue. And the lower has nothing. It has nothing. And this is a young girl, you know. I think she was like 17 or 18 years old. So we went in there and just took a lot of time. You know, the blood quite a bit out, as you can see that. So at one point we'll go in here and turn the water off and try to get some clotting. So after I get everything straightened out, got it all thinned out, you can see the chunks of tissue coming off. Now there's the water off now. Trying to get some clotting, okay? So what we've done is increase our pulse duration And it just, just so adept.
You know the FFI?
Pardon me?
What are you trying to do that one?
I'm just trying to get some coagulation, so we turned the water off,
Oh,
and we got more heat. So instead of an SSP or MSP, you're probably at LP, okay? 600 microsecond pulse, and without the water, and now you see I'm starting to seal it. It's, quiet. So eventually we'll go with the NDAG, but I still have a little bit of tweaking I want to do. I just want it to stop oozing. There's blood coming off from everywhere. And we do. We get it all to stop, obviously. So that's what it starts to look like. We're tweaking a little bit more. Use our NDAG in there to create clots. And you just paint the surface with the NDAG. And you can see that's where she ends up. So a lot of work to get there. And then we seal it up. So a big difference for her. The only problem is she never paid her bill. She stiffed me. After all that. Her and the mom. Oh well, what are you gonna do? Okay, we're done for today. Any questions?